Me alone in the dark room. I'm not nobody to talk to. Just me, myself, and I and my shadow. Lord, it's out.
I just knew that something was off. And it's not that I felt like I wanted to harm myself or do something that would be super detrimental, but I just knew that the day-to-day management of my emotions and the day-to-day management of things that were happening around me, it was not the most ideal, and I was not putting myself in a position to, in a healthy way, get through my days.
Social media influencer Roshane Rushcam Campbell talking about the moment he realized his mental health was compromised. He is not alone. A 2022 study conducted by Northern Caribbean University titled Assessing Depression in Jamaican Males Post-COVID-19 revealed that more than half of Jamaican men have been experiencing varying levels of depression. In the United States, an online survey conducted by Cleveland Clinic determined that 77% of men reported increased stress levels during the COVID-19 pandemic, while 45% felt that their emotional and/or mental health had declined. I visited a barbershop in Kingston and spoke with a customer who requested anonymity about possible mental health triggers.
Money and women. Relationships. Women in the past, when I allow women to stress me out now. This is the one thing I always teach myself, that everyone is not on the same clock. You might feel as if, hey, time is going, or whatever, but everyone will have their time to shine. It's just how you utilize it.
But traditionally, many men have been reluctant to get professional help. A taxi operator who also chose to remain anonymous said men are taught to hide their emotions.
Women kind of wear them out on them sleeves so they will show it more. And a man will more suppress it. And if I felt like my situation, psychology, I couldn't deal with, I would have seek some kind of outside support.
So why you feel man have to suppress them feelings if they go through something?
I don't think they have to, but I'm saying generally they do.
Why?
That's how they're made up. The end result is that's how they end up being wired.
The barbershop customer added that men who show emotions are ridiculed.
Society still actually frowns upon men that say, hey, I feel this type of way, I'm feeling sad, I'm feeling down. Some females will call it as a weak man or a soft man. And it's kind of the reason why a lot of men go in hiding, or they don't come out and say, hey, I'm experiencing this or whatever. They actually just internalize it and try to sort out the matter on their own, which is bad.
But that appears to be changing. Consultant psychiatrist Dr. Winston Haye says there has been an increase in the number of men seeking treatment for mental health-related issues, including stress, depression, and anxiety.
It has to do a lot with COVID, but globally we're seeing more patients come in for treatment. And it's one of two things. They've been there and now see it fit to come in. Or more persons are impacted or in more severe ways that they now see it fit to come in. But overall, both public and private, I work at the University Hospital on 121. And then specifically in terms of gender, I would say yes, we're seeing more males.
A barber who goes by the alias Bobby believes society has moved past the stigma associated with mental health.
No, man, it's a modern time now. That thing, stigma about man not to ball or man not to tell people their problem, that was one time back in the days time. Now it's modern time now. If you're feeling stressed, you can talk to someone. You're not going to be a less of a man or smaller if you don't talk to somebody. You have to talk to somebody.
And Rushcam, who publicly shared his struggles with depression on his YouTube platform, stated that younger men are more willing to seek help.
Although in Jamaica we might have that stigma, and as being like a black person also, there's that stigma. In our generation, I find that we are a little bit more open-minded, and with the internet and all of that, where people are a little bit more open, sharing their thoughts and ideas and sharing their feelings about things, I felt a little bit more comfortable, because I was like, well, the people around me in terms of proximity might not get it, but I know that there's somebody on the internet who will resonate or shame me about it.
Associate clinical psychologist Deborah Smith says allowing men to express their emotions is the first step in dealing with mental health problems.
This whole thing about a man has to be tough and they shouldn't experience certain emotions. what it tends to do is isolate the person sometimes when they're having these feelings because they believe that they can't talk to anybody about it. It has to start in the home when you're growing up, these little boys, instead of saying, what are you crying for? Let the child cry, let them become comfortable with the fact that I am hurting. But once you encourage certain types of behavior, especially in society, then what you're going to see is a lot of aggression because it has to come out somewhere. And if they're not allowed to cry and say that I feel sad, then the aggression is going to be one way that you're going to express it.
She added that in severe cases, many men may want to hurt themselves or even commit suicide. According to a recent mental health and homelessness task force report, the number of reported suicides in Jamaica nearly doubled from 34 in 2021 to 64 in 2022. Meanwhile, the Cleveland Clinic study from the United States shows that nearly 10% of approximately 1,000 adult males surveyed attempted suicide, had suicidal thoughts or wished they were dead, while another 25% felt that their life was not worth living.
And unfortunately, the completion of suicide is highest among men, and I'm seeing an increase in men with suicidal ideations. Not only older men, but also with teenagers as well.
It's the darkest time for me.
So, what are the telltale signs which suggest a deterioration in mental health? Here's Roshane Rushcam Campbell.
Everybody has their different things, but for me, I found that when I don't feel comfortable doing things, and when I say, boy, I bet I'm not bother try, or it's better I'm just stay home, or it's better I'm just looking at space, that was a telltale sign. A big sign for me was that I was not able to resolve conflict in the way that I usually do. And when I'm not talking through things, it's a hell and powder house. Those are the signs. The fact that I just could not eat. I could not keep down anything. Physically, my body was like, I was so anxious, like so nervous.
Additional symptoms may include the inability to function, risky or abnormal behaviors, substance abuse, lack of sleep or oversleeping, not eating, not bathing, crying a lot, withdrawing from family and peers, and emotional imbalance. Ms. Smith stressed that the first step in treatment is accepting that there is a problem.
Talking alone is not effective depending on what kind of disorder you have. So for disorders like schizophrenia and bipolar disorder, you normally need medication. So it becomes a team effort with the treatment. You have the psychiatrist side of it, which is the medical treatment. You get medication, or if needed, you're hospitalized for a little while to protect you from yourself, one thing, and also to protect you from others if you have the tendency for violence. It also gives you a period of time for them to balance out the medication, find out what works well for you.
There is also another treatment phase.
And then you start the psychotherapy part of it, which is the person understanding that they do have this disorder, learning about the disorder, and also learning how to manage and live with the disorder. And as a part of that treatment as well, the family and whoever else he decides to get involved. On the other side of things, if the person is overwhelmed and you're stressed out and you're finding it hard to cope with everyday life, what tends to happen is we teach coping skills, stress management skills, things how to learn to manage everyday stressors as well as major stressors in life.
Therapy can be expensive and is often not covered by insurance. Some organizations pay for psychological sessions for employees. Though the service is offered in the public health system, there is a backlog.
We're not exactly covered under health insurance. You get a claim form, and as to my understanding of it, it goes to the major medical section of the health insurance. Unlike doctors, where there is a section definitely for them and also for specialists. I don't know if there's anything along the government lines that can help to subsidize some of the treatment, especially for people who are in situations where the office can't help, or the office can only help up to a certain point. And also trying to see if the insurance companies will actually cover psychologists and counselors the sessions.
Although both psychiatrists and psychologists treat mental illnesses, psychologists are not medical doctors. Dr. Winston explains why psychiatrists are treated differently by insurance carriers.
Yeah, for physicians it exists. Generally speaking, for us as psychiatrists, the majority of things we diagnose and manage are covered, whereas it's problematic for psychologists, and it's unfortunate.
Both psychiatrists and psychologists are important for treating mental illness.
It's a significant difference, which by no means suggests that one or the other isn't important. In fact, all patients have a psychological component to their illness would benefit from seeing both a psychiatrist and a psychologist. That psychiatrists are physicians, medical doctors, who then specialize to become psychiatrists. We prescribe medication. So there are illnesses which psychologists alone would not be able to manage without medication being prescribed by a psychiatrist.
Ms. Smith noted that in cases where patients struggle to afford sessions on their own, the treatment plan can be structured to lessen the financial burden.
It's not an easy and quick fix. It's really not. And for a lot of the situations that people are in, we do recommend a minimum 6 to 8 sessions, sometimes up to 10. And if the person can't afford it, especially the frequency of the sessions is also important as well. The ideal thing for some disorders is I see you either every week or every 2 weeks. But based on the financial situation, I'm like, you have to come once a month.
And although expensive, Rushcam stressed the importance of prioritizing mental health treatment.
What I'll say is, from my perspective, that I've seen prices as low as $4,500 and as high as $8,000 per session. We'll find it if we have to go physical doctor. If you're bleeding right now, and you have to find it, you have to find it. That is the level of urgency that we have to deal with it with in terms of priorities.
The Ministry of Health and Wellness has established a mental health and suicide prevention helpline. The number is 888-NEW-LIFE. That is 888-639-5433. And for International Mental Health Day in October 2022, Jamaica joined the Pan American Health Organization's #DoYourShare campaign to encourage open discussion about mental health issues and reduce stigma. Roshane Campbell says the more mental health issues are discussed, the more comfortable men will feel reaching out for help.
If I can overcome that sort of fear of being open and share with you, then you realize that 1, there's no shame in it, and 2, you're not alone.
Everything seems blank, just I think, forget myself out of this dark up till those. Me see good friends gone, girl we did close. I just life let nature take its course.
Taking you beyond the headlines, I am Deborah Gordon.